Hi everyone.
Hello everyone.
So this is a talk on clinical UX during COVID-19. So first, just a bit about us. So my name is Dr. Gyles Morrison. I work as a clinical UX specialist. So after previously working as a medical doctor for 3 years in the United Kingdom, I've then spent the last 6 years working in digital health and clinical UX. So that's looking at user experience specifically within the realm of healthcare technology and services that either provides outputs for clinicians themselves or for patients.
And I am Vanetta Morrison. I work as a counsellor and also as a life and career coach. So my background is more on the psychology and mental health elements of COVID, which we're going to address further today.
So going through the agenda then, first we'll just set the scene with some of the key statistics or observations that we've seen with what's going on with COVID-19 at the moment.
Then we're going to look at 6 psychological responses of people to COVID. So this is based on some observations that I've done over the last couple of months. There's been a lot of research to learn from.
Then I'll be looking at health seeking and health providing behaviours. So in a bit more detail, looking at how do people actually get healthcare services and what's happening on the people who are providing those healthcare services to the general public. And then we'll end looking at ways to optimize health during COVID-19 from both our respective roles as clinical UX and counselling.
Yeah.
So setting the scene, we all know that COVID-19 is something quite serious.
Yeah.
We'll talk a bit more about how serious some of us feel it is compared to others. But in principle, the situation at the moment is not great. So we've been very familiar with this dashboard that comes from the Johns Hopkins website. They've been tracking what's actually been going on with the number of deaths in countrywide, and then looking actually what's happening with regards to people actually being cured of COVID-19, how people respond. As you can see, there's been almost 11 million people infected. There's been over 500,000 people who have died globally.
Yeah.
And the biggest area for concern would be in the United States. It's a very large population, but considering the size of other populations, there's much bigger countries, so there's clearly something going on in the US compared to China, compared to India, where there's much larger populations. And the fact that even in like the top 5, we're not seeing it highlighted with African countries. In fact, African countries are amongst the lowest affected. Doesn't mean people aren't getting sick. It's just that the response that's being made there is much, much less. And then the other things to keep in mind as well is the fact that when you look at how people are actually responding to COVID-19, it's very, very broad. Not just on an individual level, but at a governmental level. So again, looking at US, for example, you'll notice that there may be some guidance that's coming from federal government, but actually individual states have their own different responses because they have that freedom to actually do something as independent states from what's dictated from the federal states. So there's been now a rush of certain pubs and clubs being opened up to the general public, which is now causing more people to then get infected. And we're now starting to see further outbreaks. If not, actually, we're now getting potentials of second waves. I think you were looking recently, Vanetta, at the fact that France is preparing for a second wave. Anything you want to add to that?
Yeah, just with regards to the inconsistencies and the strategies of kind of reopening the economy and going back to the business as usual as much as we can within this.
And we actually live in Germany, and there's been a rise in things happening here. You were reading up as well about recent outbreak that we're facing here.
Yeah, so there's a meat factory in western parts of Germany that has been involved in one of the most recent waves of outbreaks, where we've had 1,500 infected, which means that our R rate, which everyone keeps talking about, has been affected, even though the cases are rather low, because of the fact that Germany didn't actually have that many cases to begin with.
Yeah, it was very unexpected. And the nature of it being a meat packing factory, is actually there's about 7,000 people that work there.
Yeah.
But if it's 1,500 of them that's been infected, we're talking about a quarter of the people, which is a huge number of people to be infected. It makes sense if they're in close proximity working in such an environment, but it's something that we need to be concerned about, is that the way we respond to instructions or way we respond as individuals is vitally important. We'll be talking a lot more about this as we go on. So Of course, there's going to be all kinds of ways that people do respond on an individual level. And we are now perhaps coming to a somewhat new normal. I think we will eventually get a cure to COVID-19. I hope there is going to be a point where we can actually have events face to face. But until then, there is a way that people are responding at the moment. And I think this is where it can take over, just to go into a bit more detail about those.
Yeah, so we're looking at the 60s. I love alliterations, so don't be surprised when things that I talk about tend to have the same letter, start with the same letter. And these are psychological responses that we've observed during this COVID outbreak. It kind of is a mix of the stages of grief meets fight, flight, freeze, crisis responses. And so the 60s are dissociated, destructive, distressed, depressed, determined, and doer. And although these are 6 distinct responses, they can show up in any one person at the same time, or one after the other on the same day, or moving between them within a week or in a month. And we're going to go into those a bit further. So the dissociated one is where you're so overwhelmed by the input of this COVID crisis that you feel mentally and emotionally paralyzed. And this is how a lot of people felt at the beginning. It was just a shock. It was something that you just didn't expect. So people were unable to make decisions. There was a disconnect between their mind and their body. Everything kind of felt a little foggy, and people felt lost. They didn't really know how to respond to this. And then we move on to the next one, which is destructive, which kind of overlaps with the fight response that we know of that famous framework. So it's about being confrontational, being aggressive in nature, but the actual core emotion there is anger. And in psychology, when you learn about anger, anger is actually a neutral emotion. It's a sign of the fact that your goals are blocked. And we know there's so many goals that COVID-19 has blocked or even destroyed for us. When we're looking at travel, wedding plans, new jobs, being furloughed or being fired from current jobs, going out without restrictions, not seeing family members. I know people who've given birth to children and they haven't met their grandparents yet. They're 4 months old and they haven't met their closest family members yet. So this is where COVID has blocked goals. And to be clear, not all anger is destructive, of course, but I'm making the point about the fact that aggression fueled by anger is a very relevant response in this situation. And unfortunately, we've seen this even more so when it comes to a rise in domestic violence occurrences since the lockdown has begun. Most of these occurrences will be repeat behaviors. COVID has kind of made all of us just realize what our habits and whatever bad behaviors are normally. But there's some people who maybe for the first time have been so angry and have had their anger left unmanaged that they've retorted towards domestic violence. But there's also then violence to yourself, with suicides or self-harm being possible options. The next one is distress. So this is similar to the flight response, where your aim is to protect yourself from the trauma by fleeing it. But with COVID being a global pandemic and us obviously many of us having been on lockdown, it's not necessarily possible to physically flee, but we do that mentally. And that is through being anxious, being distressed, being panic. And distress expresses itself through irregular breathing, feeling trapped, excessive exercise, worrying thoughts, and so on. Moving on to depressed. Depression is a very common response to trauma, and we're beginning to recognize there's loads of research happening with regards to how is COVID affecting people's mental health and how is that a trauma in itself. And depression shows up as continuous low mood, being tearful, irritable, neglecting hobbies, not connecting with friends when we can. So it's not talking about the physical connection, because obviously most of us weren't able to do that anyway, but it's the actually cannot even be bothered to do a virtual hangout, for example. Moving on to determined. So these are the people who see everything, including COVID, as an opportunity to prove themselves. It's about them becoming more productive. It's about creative juices flowing and goals being set, whether it's writing that book, finishing the business plan, taking up hobbies, trying out new recipes. Loads of people have started making banana bread, I hear, during this crisis. Decluttering the house, all these kind of things. But the determined is different to the doer, in the sense that there's a lot of thinking and planning going on, but not really a lot of action. And then so finally we come to the doer, who is proactive, productive, practical. And they're not necessarily letting the pandemic affect them that much. At least that is what it seems like. And we'll get to that a little bit later.
Yeah. So I will then be taking over just for us to explore a bit more about health-seeking behaviors. So when it comes to health-seeking behaviors, there is going to be obviously this quite big difference between people. And we want to try and highlight a bit more about why this is the case. So the general public already have various health-seeking behaviors, even without a pandemic. You don't know whether someone is sick already, or if they already have a disease or anything like that. And these health-seeking behaviors are often influenced by virtually everything that can make humans different. So gender, age, ethnicity, religion, sexuality, as mentioned before, their existing health status, any disabilities that they have, or pretty much anything that you could expect. Therefore, we see some very interesting behaviors, and it's going to be a spectrum. No two people are going to be exactly alike. And so as a designer, I have to appreciate not that there's an average person, but there are these differences. And in particular, when I think about these differences, I try to see, what are the extremes or the limiting users? Because if I can accommodate the needs of someone who's really likely to suffer or really likely to thrive, I can then think about how can I actually deal with people successfully in between those two extremes. So let's just look at these three areas, which is looking at people particularly who are doubting COVID-19, those who are just feeling in dread of COVID-19, and those who are already being discriminated against otherwise before COVID-19 even hit us. So this first area then of those who doubt. So those who are filled with doubt are people who just don't believe the pandemic is real, or at least as serious as some people would say it is. Therefore, they don't adhere to social distancing. They believe that young people are virtually immune, and believe that it's okay to get the disease because most likely it won't be that serious disease for them. And this is, there's so much science out there to prove that, actually, this is a real disease. People really are dying. You being younger does not protect you. In fact, you being younger could put you at more risk because you're already so comfortable with going out, socializing, and doing things that could otherwise put you at higher risk of getting the disease. So we need to think, how can we actually get people who are doubting that this is a disease to keep them healthy? The next thing then we'll be thinking about the health-seeking behaviors of people who are basically filled with dread. So these are people who are so overcautious that they self-isolate, even if they're at low, if not no risk of being infected. And they do this so to protect themselves and even to protect others. They may even be willing to avoid going to a healthcare provider. Now, this is particularly dangerous, more so of the mindset that actually, if you really need medical assistance, staying at home and delaying seeking a healthcare professional is putting your health at risk. It's making you more susceptible to deteriorate, if not die of your disease. And it really is something that we need to think about. How do we deal with people who are likely to just keep themselves at home, so that actually, even if they are at home, that we can still give them the medical assistance that they need, be it reassurance or actually being able to give them very specific instructions on when or when not to leave the home to deal with their medical problem that they've got. And then the last area is looking at those who are being discriminated against. And there are a lot of issues with regards to health inequalities. So a very common one would be that down to social economic status. So I'm talking about the fact that someone may be of a lower financial situation, the money at home is quite low, and even on an educational level, these are people that haven't necessarily got a degree, which doesn't mean that you're not intelligent. It just means that you might be less likely to get insights on how best to improve your health. And when you see people of a lower socioeconomic status, they tend to not actually seek healthcare providers, healthcare assistants as timely as others who do have come from a wealthier background, do have a bit more education in their family. And this is quite important because it means that people who already are likely to stay at home because of COVID-19 are delaying getting a rash checked out, delaying this problem with getting headaches or this pain in their chest, which could be signs and symptoms of cancer, stroke, or even a heart attack. And this is really, really serious because it could be that the pandemic itself has been the proverbial last straw to break the camel's back. Whereas they were already delaying seeing treatment, but COVID-19 has made it even more likely that they don't seek treatment. The other thing as well relating to this is that people can at times delay seeking healthcare support because their previous experiences with healthcare providers has been so bad. And this is particularly, you see this sometimes to do with socioeconomic status, but definitely because of race. You know, I've seen as a medical doctor, patients that come to the hospital much later presenting with diseases because previously they've had bad experiences with the healthcare professionals that's given them support, or rather the lack of support in the first place. And we'll talk about this a little bit in a bit. But then there's also the health provider behaviors as well. And it's quite important that we understand things that are causing problems or opportunities for healthcare professionals. So as a result of the pandemic, healthcare providers have to find ways to ensure that these three key issues, particularly those who are doubting and those who are filled with dread, that these people stay healthy no matter what. The pandemic is making it more difficult to maintain health, but you're not just trying to treat people who are infected with COVID-19, you're trying to keep people healthy in general. Women are still giving birth, you know, and people are still dying even just of old age. You know, there's still the normal healthcare provision needs to be provided. Now, when I refer to healthcare providers and healthcare professionals, it's quite a wide range. It could be individuals such as doctors, nurses, and other healthcare professionals, but it can also be all the way up to governments and international health bodies such as the WHO. Now, one of the particular areas that we find is particularly for, I can say, not just other healthcare providers and healthcare professionals, but those in positions in science as chief science officers and chief medical officers that advise the governments. A big problem that they face is actually having to ensure that the right information is being given to the general public. I think this picture sums up quite well the fact that there are times when a particular president in a particular country in the world decides to tell people that actually hydroxychloroquine is going to be the savior and is going to treat a lot of people, which hasn't just resulted in people taking the wrong type of chloroquine, which can be used for malaria, but also can be a chemical that's used as a disinfectant for swimming pools, which has then led to a fatal ingestion of chloroquine, actually killed an elderly man and made his wife very, very sick. And they completely attribute them taking that fatal dose, to what Trump has told them to do. They believe their commander-in-chief was actually there to help them, and actually he brought one of their demise. And also with hydroxychloroquine, it's then led to patients who genuinely need it for their for a variety of conditions, being told that actually we're going to stop you taking this medication for 40 days. We're going to actually give it to people who've got COVID-19. And professionally, I'm concerned that actually this reduction in giving the medication to people who are taking it for a chronic condition to now use it to treat COVID-19 is probably an opportunity to get more money for those drugs, because it's been seen as an emergency drug, which can trigger for it to have a surge in its price. So it's not a level playing field for people who need to take hydroxychloroquine, even if it was a useful medication to take. But this bad advice and bad guidance is a really massive problem. And we'll talk a bit more about how we do need to look at how we can combat this in order to keep people healthy. The next area is the fact that, you know, healthcare providers, by the nature, and I can relate to this, the reason you go into medicine, you go into the healing profession, is that it is important to you on a deep personal level to ensure that people's well-being is being optimized, that you can keep people healthy. Now, this is particularly important because of the fact that, you know, if we don't have people who are willing to go the extra mile to look after you, who will do it? If it's not going to be your doctor who's going to be willing to save your life, there isn't anybody else. And so it's very common for healthcare professionals who are supposed to just do an 8-hour shift to do a 12-hour shift. Particularly back in the day when I was working in the United Kingdom, generations of doctors before me, it was normal to work 48 72 hours. You would get sleep whenever you could, but otherwise you were on call the entire time. You still have doctors who are on call, but they will be at home and they will just go into the hospital if it's a real dire emergency. Otherwise, they will give advice over the phone. But there was a time where actually you stepped in the hospital, so you were there always doing what you could. And this picture that's highlighted now is just showing the variety of healthcare professionals who have actually given their lives in the service of keeping other people healthy. And we forget that anybody can get sick, but these people knew that they could actually die by going to work and went to work otherwise. And we've got to think they're not soldiers. They're not in an actual war with an enemy. As much as people like to use this sort of terminology to describe as a war against COVID-19, it's a disease. We get a cure from having a vaccine for it. As other diseases, there's medications that you can be taking. Here, people are still willing to sacrifice themselves because they're not getting appropriate equipment and appropriate masks and a variety of things to be keeping themselves healthy. And this is really, really tragic, to actually have to give your life for what could have been a preventable death. And in the UK, we've had about 300 or so healthcare professionals who have died trying to serve people with COVID-19. And in the US, it's about 600. And back to that point previously about people actually not getting very good care, this is an example of a lady's name's Amy Mason. And she's living with sickle cell anemia. This is a disease that can affect your red blood cells, an inherited disease. That means that if you're feeling very cold, if you're particularly stressed, if you're, otherwise just suffering from an infection, you can get your red blood cells going into like a crescent moon shape, and these can get stuck in very tiny blood vessels. But when this happens, this is a medical emergency. It can cause clots that go into the lungs, into the brain, into the heart, which can kill you. And the pain when this comes is excruciating. And this is deemed a medical emergency. And literally, there's patients that are going into the hospital with pain crisis. It's not being seen as an emergency. And actually, they could have COVID-19 as an underlying disease. And if at least they were being given the very strong morphine and opioid medication that they need to overcome the pain relief, and then have further investigations that could trigger them to be identified as having COVID-19, they could survive. But unfortunately, at the moment, we're seeing that simply by being Black, simply by being of Afro-Caribbean descent, you're more likely to die of COVID-19. In fact, anybody who is a person of color is more likely to die of COVID-19, even though they make up a minority of populations across Europe and America. So it's not just COVID-19 that is causing problems here. This is, as I mentioned before, a pre-existing discrimination against particular people. And race, for sure, is something that is becoming even more prevalent as an issue now. So let's think then, ways to optimize health during COVID-19. And as highlighted before, one crucial thing to do is actually present real facts the right way. It's very easy for you to present facts, but facts presented in a certain way can deceive people, or rather they can hear facts and just not be willing to really believe it. And worse still is actually you can be presented information the so-called right way, but be deceived into thinking that actually it is real when it's all fake. So an example here is highlighting some advice specifically regarding what you could be doing if you are actually suffering symptoms of a cough. And this was actually, I've put up Bob as a generic, I didn't want to name who really sent this as a WhatsApp. This is a real WhatsApp message that I have personally received. And, it's giving advice to say, well, if you cannot hold your breath for a certain amount of time for 10 seconds, then you must have COVID-19 and you must have widespread fibrotic lung disease. And it's the biggest load of nonsense. Now, the reason why people have believed this to be true is that it's suggested that it's come from, I think it says Stanford Hospital or something like that, which again is not a real hospital. There is no studies that backs this up, and this is completely fake advice that's being given. There talks about the fact that you should avoid drinking ice water or drinking drinks with ice cubes, that's not going to make COVID-19 worse. And you can't say that 27-degree heat is going to kill the virus. Otherwise, how comes people that are living in very warm climates where it's 27 degrees now are still getting sick? So it's nothing to do with temperature, it's nothing to do with drinks. If you ever see a message like this, please, first of all, just Google a snippet of it, just to see if it really is true facts. But most of the time, it actually isn't. So then the other thing to look at is the use of telehealth solutions. So as Yaku highlighted earlier on in his presentation, telehealth solutions are a very, very powerful way in getting people to be able to seek and actually speak to a healthcare professional without increasing their risk of getting COVID-19, without them having to leave the house. In fact, as a healthcare professional, I can speak with conviction when I say that probably 7 in 10 diseases, generally speaking, I'm not talking about if you've just had a road traffic accident, I'm talking about general issues that you would go to your family physician. About 7 out of 10 of those can be completely diagnosed with a treatment plan provided simply through a phone call. I'm not saying it's not important to go and see your doctor in person. There's many instances that even if you're being clearly diagnosed with a urinary tract infection, getting a urine sample will still be useful. The fact that you're, talking about a lump that otherwise has been described and we realize it's probably not cancer, but still being able to be seen by a doctor to check out anything else to see if there's any other issues you have, could have checked for, some other underlying disease that you didn't even realize that you have. So face-to-face appointments will always be important, but we're seeing that actually we're getting a huge rise in dealing with healthcare professionals over the phone or via video, and patients still getting the care that they need. And then the next area, we'll look at digital therapeutics. So for those who aren't already familiar, digital therapeutic is any digital product which prevents, treats, or manages a disease. And I'll probably add to that the fact that this needs to be evidence-based. There needs to be some sort of research that's been done to prove that this can help you. And it's really important to think about how we can be using digital therapeutics to keep people healthy. There is a rise that's happening, and it's partly because there's a lot of investment in this area. But chronic diseases, you don't have to go all the time to your GP or to a hospital physician a couple of times a month or every year. There's a lot of times now where your chronic disease could be managed through an app that can measure your vital signs, measure the medication concentration in your blood, measure your symptoms through what we call patient-reported outcome measures, so a very simple health questionnaire that can assess, and we need to have healthcare professionals involved in the design of such technologies so that they really are validated. But there's plenty of evidence to prove that we can provide good care to patients without having to always see them face-to-face. We can use digital solutions to measure and assess what's going on with their treatment. And then last one then is give instructions, not just suggestions. And this is really, really important. And I was quite inspired by watching the original Men in Black. You can't expect that an individual is going to be smart enough to be able to deal with issues on their own. We think that people are, and en masse. But an individual can be spoken to. But the nature of COVID-19 is that it's people that are being affected by it. It's the entire world. So you can't speak to the general public on a one-to-one level. You need to speak to them en masse. I'm sure we've been there in certain countries. You go to the traffic lights, everybody just walks across the road. One person knows it's dangerous to cross a road unless you see a green man or a green light saying for you to go, but people just go because others did it. And this is why you need to have clear instructions. It's not about controlling people because, as Jay was saying here, that people are stupid. It's not necessarily that they're not smart or dumb, but it's the fact that actually they can go on impulse. Mm-hmm. And unless you can ensure that certain behaviors are running well by most people, then you can ensure that other people would be following. So, and this is the problem with the poor instructions that some governments can give to their citizens. They're not focusing on, well, what is actually the best way to get everybody to adopt this. So moving back to you, Vanetta.
So yeah, when we're coming into, on an individual psychological level, how can we support people going through the different responses? And the first thing is the basis of good mental health is good health in all areas of your life, which is why we brought in the mental health element. And self-care refers to looking after your body, your mind and soul, and making sure your basic needs are met. We need to make sure that healthy diet is maintained, that there's enough exercise, that you're doing things that mentally stimulate you, but also relax you, something that is fun. It might also look different in different seasons. So we know not everyone can go back to the gym, but there've been so many online gym classes or games nights over video call. And self-compassion has to do with being kind to yourself despite tripping up. You know, we need to remember that after all, we are in a global pandemic, so we need to cut ourselves some slack. When we look at the different personas as such, those who are dissociated or distressed, grounding techniques and control are the most important things. These are the basis of those is anxiety. So when we talk to people about anxiety, it's about breaking that what if the worst happens cycle and anchor them back in the here and now moment. So remind yourself and recognize there are still things that you can control, even if COVID-19 is consuming. Focus on the things you can control, even if they're as small as what am I going to wear today? What am I going to eat today? Just focus on the things you can control. Also, minimize your intake of COVID-related information to no more than maybe once a day, and ideally, literally just what you need from your local government advice. There's so many conspiracy theories out there. There's so much rubbish and trash out there, and we want to make sure that we're not overwhelming our nervous systems with things that are actually not true. The next one is for those who are being destructive. If you're a victim of domestic violence, you need to contact the relevant support helplines in your country. Call the police. It doesn't matter if it's an unprecedented time. It's not acceptable for anyone to be violent towards you or people in your household. The same goes if you or someone you know is having suicidal thoughts or is self-harming. Please seek help. Call the police. In addition, it might help to seek a counselor to work through your anger in a safe way. Then we've got those who are potentially depressed. If you already have a clinical diagnosis of depression, then you should definitely get in touch with your GP. And like Gyles was saying, a lot of people's ongoing healthcare issues aren't being regarded at the moment because people are just focusing on COVID. But if you already have depression, you should be speaking to your GP. You should be speaking to a mental health care provider. If your symptoms are, if you feel like you're having new symptoms, have a look at, again, having a conversation with your GP, seeking out a counselor. There's so many counselors offering online therapy at the moment. And other suggestions are things like self-help guides, mindfulness activities. And then finally, for the determined and the doers, I would recommend coaching and counselling. So it's looking at time management, productivity hacks. The downside of being a doer is the fact that you can actually burn out, or you might be hiding emotions behind your actions, or you're just doing things for the sake of doing things. So again, it's about making sure your self-care routines are strong, that you're spending time reflecting and resting, and also making sure that what you're doing is connected to your greater purpose.
So thanks for listening. Please stay in touch. You can find us on LinkedIn. You can send us an email. You can also find us on our respective websites. For me, clinicalux.org, and for you, Vanetta,
it's blueprintway.com. Thank you.
Cool. So, Gyles and Vanetta, I wanted to actually just ask you more of a personal question. So, which new habit did you guys personally start during COVID-19?
That is a good question.
That's
because
a really good question.
As you know, we do a lot of cooking already. We've actually got our Instagram page, that Morrison Kitchen. So there is quite a lot of food there. And we moved house actually on April 2nd. And it's a bigger kitchen, and it's a nice kitchen. And that gets used quite regularly. And I think, I don't know if there's been anything in particular that we've been cooking more than usual, though.
I don't think so. And this is the thing. I think we've been trying to, because we moved countries and then we moved house within the new country. We've not really had time to kind of look at new habits and setting new routines yet. We're just kind of managing the chaos at the moment.
Yeah. So I think there's not been much chance to adopt new habits, apart from, I suppose, being indoors so much. Like I am quite a homebody anyway, but it's just not feeling like, oh, just go down to the shops and maybe go to a nice restaurant or go to the cinema. There's been, I tell you what has been a habit actually. There's been a lot more watching of the Disney, Netflix, Disney Plus, that's definitely gone on the rise now.
Yeah.
So yeah, a lot more TV watching, I think.
Yeah.
That's good. There are a few questions in the comments. We have from Sean. What are some of the challenges that you found with telehealth solutions?
Yeah, that's a really good question. I think perhaps the biggest challenge with telehealth is just how slick is the onboarding experience for a patient. So I've seen solutions where telehealth has literally been the doctors telling the patient, can you use Skype, please? Now, what people forget is that if you're using Skype, you need to have an email address. You need to create an account and then log in so that you can then go into the call, and then you need to find the person that you're going to have the call with, or they need to find you and invite you. Now, if you've never used a computer before, you might as well tell them to go and resuscitate this person who's just dropped down dead in front of you. Like, this is an overwhelming task for some people. We take for granted that actually it can be about, what, a third of the population of the world regularly uses a computer. Like, when you see everybody's got a smartphone, it doesn't mean that they've always got a computer that they're using at home. And so having a solution where actually all it is like a link in a text message that's been sent to somebody, and then you click that link and it takes you straight to a browser and you're automatically in the call. Now, this is perfect. And it's not just perfect for someone who is okay with a smartphone that's got text and it opens up a browser, but it's okay for someone who is tech savvy. And this is one of the beautiful things about user experience, is that when you identify those who are going to struggle the most, who need to be helped, if you can help them, you're going to help loads of other people as well. So I think that's probably the biggest area in telehealth, is how easy are you getting the patients to be able to use this telehealth solution in the first place?
Yeah, there's some good points there. And something that I was wondering was that, yes, this integration of apps in healthcare has been a long time coming now. So how do you get the right apps to the right people? What does that look like? You know, does it have to come from doctors directly, like a prescription? Or, you know, how does a private company get a relevant application to a user? Does that come through advertising, or is it recommendation and word of mouth?
This is a wonderful question, and there is different strategies that's employed. I think by far the most effective way to go from we've made a great app to it actually having measurable positive impact on someone's health is when it's prescribed. If you can get a healthcare professional, doctor, nurse, even pharmacist, if they tell a patient, use this app to improve your health, almost 100% of the time they're just going to do it because it's part of their treatment plan. When it comes to advertising, this is where brand recognition is quite important. So there's the likes of Babylon Health, which there's times where actually there's very polarizing views on how good Babylon Health is as a solution in the United Kingdom to provide access to a doctor over the phone or on video conference call. And, you know, but because it's so in the news, because we have people like Matt Hancock celebrating Babylon, a lot of people will rush to use it. And so actually it becomes a situation where the advertising is not just how much money does a company have, but can you actually get the support from people in positions of power, positions of authority? I think the other thing to keep in mind actually is, are you as an individual looking for these apps? And then if you're looking for them, are you aware of what would be the right criteria to measure if they're going to be helpful or not? So you can find all kinds of healthcare apps on an app store. Most of them are going to be garbage. Most of them are going to actually be dangerous, particularly ones around mental health. They could make a lot of claims that have never been validated through some sort of trial. And so generally speaking, I would avoid using medical apps unless a healthcare professional has recommended it, or perhaps some sort of patient advocacy group or patient or a disease foundation. If they are recommending it, then it's more likely to be useful. But if it's a general app on the App Store, I wouldn't recommend it.
Siegfried, who I think might actually know you, he said, thank you for the clear message. How did COVID affect your Congress? Does the online event work well? And he said, nice to see you again.
So I think in general, doing online events is the way forward. there's been events that I've been trying to do, which all just shifted to online. And it causes a lot of disruption because the first thing is that as much as people had booked in their time to attend a conference, I think COVID-19 has affected people's lives in such dramatic ways that they're suddenly like, you know what, I can't do this conference no more. And I think this is where it's starting to now cause a lot of problems actually, is that working from home is a huge shift and actually creates a lot more tensions in the home, as much as if people are like, oh, I don't have to travel anymore. I think that's something that people haven't fully kept in mind. And as Vanetta was highlighting, there's 6 different ways that you can be responding. And even something as simple as doing online conferences, people never knew that this is the only way that we would be able to meet. So it's been a culture shock, I think. Big shift.
Definitely.
And it's actually opened up a whole new world to a lot of us as well. So what I find is that I'm having a much more international flavor to my conferences and events. So where previously I also hosted a meetup in South Africa, and we used to get local speakers to come and speak to us. But now I've actually arranged for people from the UK, people from the United States to present. So all of a sudden the world has also become a bit smaller for all of us.
Yeah, which I think is really wonderful. In fact, I've done more conferences and talks over the last few months than perhaps in the 12 months beforehand. So there's much more appetite now for people to learn from home.
Yeah.